Hey there, my name is Preetham Ranjana and I'm talking to you about a very interesting topic called as Bells Palsy. Why am I talking to you? Simple reason is because I was a patient of Bells Palsy. In fact, I was patient of bilateral Bells Palsy. What is Bells Palsy? I'm sure people around you, there must be someone, maybe you yourself are suffering through this particular disease, or you have someone in your distant family or in your friend circle wherein the person suddenly realized that on one fine day a part of his face had stopped functioning. The nerves have stopped functioning. You can hardly move anything on part of your face, or if it is bilateral, you cannot move anything on your face. If this is the problem that you're dealing with, here is a video just to tell you that the recovery is definitely possible. There are ways to get there, and the reason I'm talking to you is because I have gone through one of the most complex types of Bells palsy, which is called as bilateral Bells palsy. So here we go. When it happens to you, typically you'll realize that your nerves are not functioning. The nerves come right from behind. So it's like a tree structure. You'll have the root coming from behind the ears and you'll have nerves all over the face. Now, some of the nerves or all of the nerves, if they stop functioning, you will not be able to move certain things on your face. There are two kinds of nerves, right? Nerves which gives you sensation. Is it hot? It is cold? Is it touched? And then there are nerves which will help you move your face. Now, when someone will face a challenge like Bells palsy, when your eyes don't move and your lips don't move the way you want them to move, your cheeks are not moving, you're not able to smile, let's discuss what are the various things which you can observe. You might not be able to move anything, and even your eyelids. So problem could be that you're not able to close the eyelids, and that's the reason even when you're sleeping, the eyelids are not completely closed. Because of which you will have a lot of irritation in your eye, your eyes will go red, which is obvious, right? Because eyes are not getting closed. Okay. Another thing could be the way you breathe. Now, the nerves not only control the movements on the face, they also impact internally. So, the way you breathe, the typical pattern where you breathe from one side and then breathe out from other side, and then after a while it shuffles, it stops functioning. You directly breathe in and breathe out, and this is why you feel a little tired. Because you're not able to move your cheeks, you will not be able to chew properly. Because when you chew, your cheeks actually help you in moving the food inside the mouth, in the right way. Otherwise, if these things are not functioning, the food will get stuck between your teeth and your cheek. Many a times you'll simply bite your cheeks because you cannot control it. Your lower lip will fall down because there is nothing to control, and because of which you will not be able to speak the letters for which you need both lips. P, B, all the words for which you need the lower lips, you will not be able to speak them proper. So your diction will go for a toss. You will not be able to stand straight or, even sit straight. And these could be some complications that you might observe. If these are the complications that you're going through, don't worry. This is a symptom, this is an outcome of something which is not working, but trust me, you can get there where I'm standing today, right? So here is a little journey about how I recovered through this whole thing. See, if you go in allopathy, most of the doctors will treat you with steroids, a heavy dose of steroids, and I've heard that for many people it works. It didn't work for me because I had bilateral, my both sides were completely clueless and dead. The nerves were dead, right? Almost dead. So it didn't work for me. But a lot of steroid doses and supplements, of course, Sometimes they give you medicines for depression. I don't know how it helps or how it is related, but there is a chance that if you are down with Bell's palsy, you probably will get depressed as well, right? One of the most prominent identity that you have, your face, has gone completely blank. You have a puzzled face. Nobody can make out whether you're happy or whether you're sad or whether you're laughing on their joke. Nothing happens. You're just stand still. Okay, so these are, some of the complications that you might find, if you face with this disease called as Bell's palsy. And the treatment that I talked about from allopathy. Now, physio is very, very important, and they'll prescribe you right from the day one the exercises of face. Along with physio, they'll prescribe you electric stimulations, which is part of physio. For me, I think stimulations and physio made the real difference along with supplements. I tried Ayurvedic supplements because I thought that allopathy, injects a lot of chemicals in the body. Ayurvedic is more of a healing technique. A typical Indian authentic Ayurveda medicines is which I took, and I think it helped me. So the team physio from Pune and Rasayu Clinic of Dr. Yogesh Bendare from Pune, they treated me, and I took stimulations for good 7-8 months. In fact, the more stimulations that you take in a day, at least three or four, I think it helps because, of course, you don't have to do it a lot of times because even nerves will also get tired. So you can start with 2 and then go to 3 maybe in a day. But if you have to visit the physio every time, one way to handle this challenge is that, buy the machine and learn how to do it. Nerve is like a wire, and electric stimulation is like passing a current through the particular wire. So there is a one rod here, and you put the other point behind, and then you pass a small current and it travels through that wire to keep that wire alive. So that's the technique that they use, and it also works. In fact, acupuncture also works, and I tried it pretty late. They say you have to try it little early, which is, putting needles where the nerves are and then passing those small currents through those to help you heal. So these are some of the things which work, and I think it worked for me. So please try that. Now, beyond this, I think one of the biggest contribution that happens in the process of healing comes from a mindset of your doctors, mindset of your family, of your friends, and your own mindset. So, if people around you, if they look at you with a pity, it's an unnecessary empathy. You have to show a lot of confidence and faith in the person who has gone through this and kind of treat him as if nothing has happened. Treat her as if, she's absolutely normal. I mean, don't try to help with every little thing. If the person is not able to stand properly, and if you're helping him by giving everything in his or her hand, it is not a help. Rather push them, treat them as if they are normal, and this is how even they'll get motivated. When they see that hope and that faith in your eyes, that is what works, because they get that faith, in themselves in the process of healing. So very, very important is having faith and having patience. There will be people around, even doctors. I have faced 2 kinds of doctors. Doctors who give you a lot of faith, and doctors sometimes who just give you a lot of negativity and a lot of insights about how complicated this whole thing is, and it's okay, maybe it's their profession to set expectations real, but just take what is important for you. Don't let your mind get influenced with that negativity, okay? And in this process, it is very, very important to keep experimenting. Every little progress that you see, treat yourself, and try to do it more often. For me, I could see a millimeter movement on my right eyebrow after almost 6-7 weeks, so which is okay. But at least there is a movement. There is one step towards recovery, right? So keep doing it. You will not get results so easily. It's like training the brain. It's like the way child learns to walk or even to speak. This is how you need to train your brain, because brain has to learn. And if you have, a regular Bell's palsy which is only on the one side, recovery can happen in less than 3 months because there is a reference on the other side. When brain understands that, something is moving here by giving an instruction, it gives a similar instruction on the other side, and that's how the nerves is kept active by the brain. So if it is only on the one side, which is in 99.99 cases, you will recover pretty fast, in 3 months for sure. If it is bilateral, which is a rare case, okay, brain does not have a reference. Now when brain doesn't know what instructions to give and to whom to give the instruction, you cannot progress. This is where imagery helps, which means that imagine a mirror in front of you, imagine your face, and imagine the face is moving. And as the face moves, as you see expressions on the face, your brain understands and tries to replicate those expressions on your face. So it's training the brain to help the movement of nerves. And this also is a great technique, and I've seen very good results of this particular technique in my case. Now you can try different things, when you're trying to validate your own progress. What I did is that, I love music, and I'm sure every individual loves music. I used to sing songs pretty loudly. I used to read out poems. I used to read out ghazals. And it helped me in validating my own pronunciation. In fact, I tried various things. I used to sleep and speak and record my voice because, my lip, when it was falling down, I was not able to speak certain, letters, right? So in a sleeping position, can I talk those? Can I put a band here and speak those words? In fact, you have to keep yourself busy. I started working in 3 months because I was able to sit and stand and speak, a half-broken language. So I started interviewing. Now I'm an entrepreneur, and the biggest challenge was to pronounce the name of my own company, Incube Experts. But you have a trick, right? I used to ask my HR to introduce me, and then I used to conduct the interview. So you have to just ask questions and listen to the candidate and take notes. So find ways of keeping you busy. Feel good about yourself. Sing, laugh. Have your own benchmarks. Like in my language, there are very complex tongue twisters. There are these, very interesting, I would say, prayers written for God, which has got a lot of complex words. And I used to recite those loudly, not because I am a religious person, it is just because I want to test my pronunciation. So try everything possible, validate yourself, feel good about the progress, and just have hope that you are going to get there sooner or later. So that's in brief about the disease and the impact of the disease and the path to recovery. So the only reason I'm doing this video is to convey you that the recovery is possible, definitely possible. Now, when your hand is fractured and if it gets recovered, you don't expect it to be exactly the same as it used to be probably before the fracture. Same with palsy. If you can do everything that you want to do, then just don't worry about, is the recovery 90% or 97% or 99%? You should be happy about the recovery, and which will keep pushing you towards even better recovery. So these are my 2 cents. If you want to, have a chat with me, I'm giving my phone number. It is 8975750018. If you are trying to reach out to me from outside the India, it is +91 8975750018, and WhatsApp me. I might respond you a bit late on weekdays, but on weekends I'll definitely reach out to you with my feedback, with my experience. And even I would like to know if you have gone through a similar experience, because it's a community, and there are a lot of misconceptions about this particular disease, and because people get worried, because they get into a panic mode, I thought that it is important that we should talk about this more often. So all the very best with the recovery, and let's keep talking. Thank you. Bye.